Gum recession may happen in relation to periodontal disease often, but there is this one habit that many of you could be actually doing is contributing to that gum recession without even knowing. My name is Dr. Mo, and I'm a dentist. A lot of people can be brushing their teeth on a regular basis. In fact, every day, maybe twice or three times, they're using dental floss. They think everything is okay, but sometimes they look at their teeth and they may see gum recession happening. And let's say if they have a right dominant hand, they may see it on the left side of the teeth, the upper left side or left side in general. They may be confused, like they're brushing, they're doing everything right. Why is gum recession happening? There are many reasons as to why gum recession may happen, but today I'll be focusing on the misuse of toothbrushes. You may say, what? A toothbrush and gum recession? What do they have anything to do with each other? I know, many of you may be confused about this. That's why I made this video. Okay, so imagine misuse wrong toothbrush and using it in a wrong way, which I'm going to explain what I mean by wrong way, can contribute to a result like this. Okay, so let's start first of all with the toothbrush bristles. Okay, soft, medium, hard, etc. A lot of people think, okay, when they're buying, let's buy a hard toothbrush. The problem with a hard toothbrush is that a hard toothbrush is too harsh on these pinkish tissues. You see them, the gums, as well as even too hard on the teeth. Okay, this is the problem with a hard toothbrush. It's very harsh in the gums, very harsh on the teeth. Okay, it's abrasive on the enamel, it's too harsh in the gums, can contribute to gum recession. That is a toothbrush hardness. Okay, hard instead of using like a soft toothbrush. Another thing that's to be taken into consideration about toothbrushes is someone has a manual or an electric toothbrush, but they use it with a wrong technique. Okay, so they brush horizontally, they're hard, that can contribute to gum recession, or they brush even vertically too hard, that can also contribute to gum recession, especially with a hard toothbrush. So you may have seen before these illustrations of brushing at 45-degree angle with regard to a toothbrush. Okay, somebody says W stream. Thank you everyone. We're recording a clip to be posted also as a video later on. So that's a brushing technique. So a wrong tooth brushing technique can contribute to gum recession. Okay, a lot of people don't know what is this. Is gum recession. This is the gums moving away from the crown, exposing the root. I'm gonna also talk about what are the problems, and you may be surprised when you hear what are the issues that may arise if someone has gum recession. Is it aesthetic only? Meaning this is not a good appearance. Okay, so it's not only aesthetic or cosmetics. There are also other issues that can arise when gum recession happens. So we talked about the technique and brushing at 45-degree angle when it comes to the upper and comes to the lower, and even when cleaning from the inside. Of course, brushing the occlusal surfaces, which is the surfaces you bite and chew on, very important. But we're focusing on things in relation to gum health and gum recession. So brushing technique is one. What else? We have the hardness of the bristles. When someone's buying a toothbrush, they see hard toothbrush, soft toothbrush, medium toothbrush. Okay, I talked about the hard toothbrush being harsh on the gums and on the teeth, on the enamel. That's an issue with the hard toothbrush. I personally use a soft bristle toothbrush. How can you know when person is buying the toothbrushes? It will say often on the label hard, soft, medium. Okay, I personally use a soft toothbrush and I'm a dentist, so it doesn't mean everyone should. Please consult with your dentist, but I'm just talking about the evidence we have. Okay, so the brushing technique, the bristles, soft, hard, medium. What else? Okay, so how strength used, or how hard, like how hard or how harsh the person's brushing. Welcome, Marion. Welcome, everybody. Someone says W stream. Hello, everyone. Just 1 second. Talk about something important. Everybody, please double tap, like on the stream, also, and comment, say hello in the chat. Yes, the harshness, and the strength when somebody is brushing. So a lot of people, when they go to brush, they start brushing very aggressively. Okay, they think they clean better this way or it's better this way. It's not. Okay, it is absolutely not. To brush teeth in a very harsh manner or in a very aggressive manner contributes to, you see this? Gum recession. It's not a good idea, okay? So that is also in relation to brushing aggressively versus just brushing gently but effectively and with the correct technique and the correct toothbrush type. All of these things are very important. What else? Now, of course, there's periodontal disease, which causes gum recession as well. So I will make separate videos about periodontal disease. Right now, I'm gonna get into what are the consequences of gum recession. So someone gets gum recession, the gums are receding from the tooth, they're showing the root. So what happens? As you can see, look at the photo. So we have the crown of the tooth and we have the root of the tooth, okay? And the root is typically covered with the gums. And there's a reason for this particular design, like biologically. So the crown has its external layer as enamel. The root has a different external layer. You see it, even its color is a bit different. That's called cementum. The root surface, without using too much medical jargon, is more sensitive, generally speaking, in compared with the crown surface. When gum recession happens, and when you speak with people who have gum recession, very often they're going to have teeth sensitivity. That's very problematic because these teeth with gum recession and the roots exposed can actually be very sensitive. Okay, so this is one of the consequences. Another consequence, of course, something like this is not really that easy to be managed, even by periodontist. It's a whole thing, it's a whole procedure that needs to be done. Another consequence, so people see this and they think the gums are receding, okay, they will see a specialist to fix things, but what are other issues? Often with gum recession, there may be issues with the underlying bone, so there could be bone loss as well. Actually, as bone loss happens, the supporting bone, the gums follow, because the gums really are serving as something to cover, okay, that supporting bone. So when there's bone loss, gum recession follows. That's why I said in periodontal disease, which is involving the supporting bone, the tooth supporting bone, the gum follows. Okay, so you end up with something like this. Other consequences are, of course, aesthetic, cosmetic things, and you notice that I left that towards the end, not because it's not important. Of course, aesthetics are important, but things that are biological, things that are actually happening, are very important also. So this is not the most aesthetically appealing thing or most cosmetically appealing thing. As you can see, aesthetics are affected in a big way. And we have the black triangles and big gaps that are forming between the teeth. The color of the root, I told you, is different from the color of the crown. The external layer is different. The crown is covered with enamel. The root is covered with cementum, okay? The gums, the pinkish gums, are typically aesthetic. In this case, they're moved far away from the crown, so that's not the most aesthetically or cosmetically pleasing thing, okay? So TLDR, please consult with your dentist. Of course, it's for educational purposes only. Don't forget to leave a like, share this with your friends, okay? I'll take some Q&A. If there are questions, it's fine too. I made in this cafe, it got cold. Meta says, hi, welcome my friend. I just do a video section because I'll post this. How's everything going? Yes, I remember Kate is a Russian TikToker. I'm friends with her surface level. I don't know if she will join today, we will see.